You don't want the orthopedician to treat it. Mounika, how many O's are there in oncology? 1, 2, 3 or 4? Quick, 4, 5.
3.
3.
I used to ask him doubts at all the time, like evening, morning, anytime. He used to reply and he used to explain in a detailed way.
I understood which topics to focus on, which topics are frequently being asked.
Hello everyone, this is Dr Rahul Rajeev. I am the medical group faculty for NEET SS and neurology faculty for INISS at Doc Tutorials. So this interview is a special one. It's a heart-to-heart conversation with 3 dear students who are now 3 toppers for the recently concluded INISS DM entrance exam. So I have with me Dr. Vineetha, Dr. Somnath and Dr. Mounika, who have secured amazing ranks in the INISS entrance exam. So let's know more about them, how they have prepared and also some fun facts about them.
Hello everyone, I am Dr. Vineetha. I have studied my MBBS from AIIMS Bhubaneswar and I have completed my MD Internal Medicine from PGI Chandigarh. Now I have secured rank 1 in DM Rheumatology in INISS July 2024 session.
Hi everyone, I am Dr. Mounika. I did my MBBS from Osmania Medical College. I did my MD in Internal Medicine in AIIMS New Delhi. I secured AML rank 2 in INISS July 2024 session in Medical Oncology.
Hi, I am Dr. Somnath Gupta. I have done my MBBS from Burdwan Medical College, West Bengal, and MD from Rajendra Institute of Medical Sciences, Ranchi. And I have secured a rank of AML 3 in Medical Gastroenterology in this July 2024 INISS session.
Dr. Vineetha, if you were the Health Minister of India, what salary would you give to a medicine resident per month?
Per month, for the work they are doing, I would give at least 1,05,000 around.
1,05,000 rupees. Okay. Somnath, how much will you pay a medicine resident?
I think the amount of work they are putting in, I don't think that can be put into monetary terms, but still I think he should at least get more than what an assistant professor gets, because that is kind of work he is doing.
So Mounika, what do you think? If you were the health minister, how much would you pay a medicine resident per month?
Sir, around 1.5 lakh.
1.5 lakhs. So the toppers feel that 1.5 lakhs is the salary that a medicine resident rightfully deserves. Mounika, who would make the best couple among specialities?
Among specialties,
Peds and gynec. Okay. Somnath, what do you think? Who would make the best couple?
It depends, I think, sir, more on what they have in common, I think.
Yeah, but still, just take a guess.
I think surgeons and anesthetists have always
Surgeons and anesthetists, at least they can be together.
yeah,
Most of
they
them.
have been
Okay.
historically.
Yeah. And the trouble happens when the wife is the anesthetist.
Yeah.
She will not give the consent for the
Consent for
surgeon. Okay. So, Vineetha, what do you think? Who would make the best couples?
In medical specialties, I guess rheumatology and hematology is a good match.
Rheumatology and hematology is a good match. All right. Good. Mounika, when did you hear about this term medical oncology for the first time?
Medical oncology I heard in UG only, but I never had that interest or all
Okay.
that. But when I went to MD as a rotatory posting, then I got interest in all the cases, lung cancer and all that.
Okay.
So
Right.
here, like MD is the one which
Okay,
makes the
right.
big decision.
Right. Vineetha, rheumatology. When did you hear this term first?
In UG only, because we had one professor who has done rheumatology but working in medicine.
Okay.
I didn't know what exactly the spectrum of rheumatology, but I heard the term. Then in MD, since rheumatology is a part of medicine in PGI, so we were working in that unit for 1 month. So at that time, I really liked, that was the best posting in
Okay.
my first year,
Right.
second year.
Right. Okay. Somnath, so you are going to become a medical gastroenterologist.
Yes, sir.
What do you think is the medicine that you're going to prescribe in your life for the maximum number of times?
PPIs, I should say.
PPIs. All right. Okay. Right. Vineetha, rheumatoid arthritis should be treated by rheumatologist or orthopedician?
Should be treated by rheumatologist.
Why?
So, because it is a rheumatological condition.
Condition. Okay. You don't want the orthopedician to treat it.
No, I don't have a problem with orthopedician treating it, but it has to be treated as rheumatoid arthritis should be treated.
Okay. A patient with low back pain should go first to option A, general practitioner, option B, rheumatologist, option C, orthopedician, option D, neurosurgeon. What's your answer?
A general practitioner.
General practitioner. Okay. Why?
Low back pain is a very non-specific
Huh?
complaint.
Right.
So there are like 100 causes to low back pain. Only after the general practitioner feels it is a mechanical cause or a rheumatological cause, only then he should refer to an orthopedician or a rheumatologist.
Okay.
And only if the MRI shows compression, then comes the role of neurosurgeon.
Okay. Right. Right. Mounika, how many O's are there in oncology? 1, 2, 3, or 4? Quick. 4, 5.
3.
3. Okay. Now tell me, out of you three, anybody has an interest in teaching?
Yes,
Teaching.
sir, I do have
Okay.
interest.
You have an interest in teaching. So after your DM rheumatology, you would like to take up teaching as well. So just tell me, what do you think? Take a guess. As a clinician and as a teacher, how much money will your faculties be earning per month? Say, for example, how much money would I be getting per month?
Maybe around 4 to 5 lakhs.
Okay, 4 to 5 lakhs. But I'm not answering this because we don't. The national board doesn't release the key. Somnath,
Yes,
something you love about medicine?
Some problem solving, I think, is the basis of medicine. Like I like problem solving and an application of the knowledge in a
Problem solving and application of knowledge. Mounika, during your MD medicine days in AIMS Delhi, which postgraduate specialty were you jealous about? You were running about in the wards, and which postgraduate specialty you were jealous about?
Endocrinology.
Endocrinology. Why?
So they have like less ward and only OPD,
Huh.
little chill.
Okay. So you would want a chill life.
Yeah.
Right. Okay. So Vineetha, during your MD days in PGI Chandigarh, can you tell me which postgraduate specialty were you jealous about? You were a medicine resident running all around and seeing other branches. Were you jealous about some specialty?
Jealous in the sense like if I'm doing a lot of work and they're chilling, that kind of thing, then I would also say endocrinology.
Endocrinology. Okay. Right.
In the other way, I would say pulmonology because like they are like stalwarts, and I was like, okay, maybe someday I can become at least a little of as much as they are.
Got it. Got it. Somnath, what do you think about the influence of AI in the future in the career of a doctor?
So AI is definitely coming up, and it's definitely people are thinking it to be a challenge, especially in fields like radiology, where I think where AI may in the future make a significant contribution to understanding and faster processing, like particularly in respect to the the workload of a radiologist. It may help him in decreasing his workload, and it may also help us in easier means critical decision making, like how to get along means, and having information at our fingertips.
Mounika, who is one faculty who has inspired you the most from your college days? During your MBBS, you can tell one faculty, and maybe during your MD days as well. Your favorite?
In MBS, my principal ma'am, she is microbiology HOD, Shashikala ma'am.
Shashikala.
She used to inspire us. She used to, the way she teaches, make us get interest in all the topics.
Okay.
And then in MD, Siddharth Jain sir, and he's rheumatologist, but he joined us faculty in medicine. The way he puts differentials, the way he thinks, that put a point in us, like this is how we have to think, and that's how. And then before joining in medical oncology, our HOD Samir Bakshi sir,
Okay.
he also he also inspired me.
All right. Dr. Vineetha, starting with your MBBS days.
In MBBS days, Manashwini ma'am was there. She was a biochemistry professor.
Okay.
So she was very inspiring in the way that she's very hardworking and sincere professor, and she used to motivate us to like aspire high and achieve those goals. And another professor is Dr. Rajesh. He was a rheumatologist from AIMS Delhi. He worked in medicine department in AIMS Bhubaneswar. So sir also. Then in MD days, my HOD Sanjay Jain sir, and rheumatology. The interest I got is mainly from Aman Sharma sir.
Okay. Right. Great. Great. I think you're blessed to have very good training as well. Somnath.
From my MBBS days, I think it was in my first year, our physiology HOD, he was Dr. S.K. Chaudhary.
Okay.
And he used to give personal attention to each and every one student. Like we were a batch of 100, but he knew each and every one by name, like how we were doing, how we were coping up. Because first year MBBS is definitely tough. We are so far away from home. Like he used to care for us like a parent, like a father figure. So that was more important for us in first year. And he was an excellent teacher as well, no doubt. Like he used to come even in the rain and storm. He used to come for class.
Okay.
Even though we might not attend, we would think like, no, there's no electricity, there's nothing, let's skip it. But he would never definitely miss. And the bad part, what I feel is like he retired just a few years ago, I think 2 or 3 years ago, and he passed away suddenly after 1 month, just after retiring. So we feel like students were his life. Like after he retired, he could not cope up with that.
Vineetha, it's a common notion that toppers just study. So you are rank 1 at the national level. So tell me, what are your hobbies other than the obvious hobby of study?
So, singing
Singing.
and reading some general books,
Okay.
mostly self-help books.
So would you mind singing a few lines to the viewers? Yeah, she's ready. Okay. Right.
It's all Telugu Carnatic music, sir.
That's fine. Lights, camera, action. On Vineetha.
అదివో అల్లదివో శ్రీహరివాసము అదివో అల్లదివో శ్రీహరివాసము 10,000 శేషుల పడగలమయము అదివో అల్లదివో శ్రీహరివాసము.
Nice. Vineetha, what is something you like about medicine?
Everything in medicine I like the main thing is the logic it creates in the mind, and so much of internal thinking that has to go into making a decision. That's what I like, and also the intricacies of medicine and linking everything together, the connections, joining the dots. This is all what I like.
Dr. Mounika, what do you think? How has your MD medicine residency training helped you, in the journey to become a super specialist right now?
MD general medicine is the base. Over that you have to develop other knowledge. It will stay with you lifelong. Even anything, any management, even electrolyte management, and even the infections. Even medical oncology also, patients will come with so many infections and all electrolyte disturbance. So it is the one which you have to focus on general medicine first, and later on only then you have to decide for super specialty. Just skipping the medicine is not the thing, even though your final destination is super specialty.
Now this is very important because Dr. Vineetha and Dr. Somnath, you know that I am taking lectures for NEET PG as well. So if some of my students, when they get good ranks in NEET PG or INICT and they get medicine, one question they ask me is, sir, I am just about to join for general medicine. I want to become a cardiologist. So shall I start reading cardiology alone? You want to become a cardiologist on day 1 of joining medicine residency. But it's a very valid point that she told. It's very important that you be a good physician first, and from then you will become a good super specialist. I think a very valid point was discussed by Dr. Mounika. And again, coming to Somnath, what do you think? How was your journey during your residency days, and how has it helped or how has it shaped you right now?
Absolutely, sir. I think the residency days are the most crucial part of a doctor's journey because since we are learning each and every day, we are seeing patients, we are managing patients independently, we are presenting cases, even from academics to bedside teaching, each and everything we are doing, and then I think we are it's providing a base for us to work on in the future. Even if we become super specialists, we are always going to be physicians first. That's what I believe.
Yeah, and again, what do you think? When you started off your journey as a medicine resident, uh, was it so exciting those residency days? And how do you, looking back at those days, what is your feeling right now?
So starting of medicine residency is definitely the most exciting thing, because when we are in internship, we are like kids, like kindergarten.
Okay.
And then when we actually start doing things in medicine residency, that's really thrilling and exciting when we start learning new things. Then during residency, we get to know what our actual interest is. Reading books gives interest in a particular specialties for some, but it might change during the residency period when you're actually dealing with those patients in every specialty. So residency days help you decide the specialty and also build a base for whatever specialty you want to do.
So, Dr. Mounika, you have followed the oncology videos from Doc Tutorials, and in Doc Tutorials, the oncology videos have been taken by Dr. Hemant sir and Dr. Vijay sir. So, I just want to ask you about those videos, because it's very important to have a solid content which will help you in solving those MCQs. So, first tell me, how did the videos of Dr. Hemant sir and Vijay sir help you in your preparation?
Sir, I made my notes while seeing videos.
Okay.
So, in the way which I wanted, like in shortcuts and all. Then, sir used to stress the points. This is the previous year's question. This is the previous year. This has come in INISS.
Okay.
So, he used to stress on the points which are most important.
Okay.
And they made the staging very easily. So I used to note every point and everything. Sir, I started my preparation medical oncology with videos only. So medical oncology is a very vast subject, and it is very difficult to understand each and every mutation and each and every pathway. So sir used to simplify the topics and used to stress on the top and each and every point. Like this is how you have to read, and he made the staging and everything very simplified way, and then he made the vast subject into a very understandable and easy way.
Yeah, see, that is very important, like when you prepare for a subject like oncology or neurology, I think what toppers actually do is they make the content concise and crisp. And I think such sort of a guidance by Dr. Hemant sir and Vijay sir helped you make the content more concise and crisp. And I just also want to know from you that apart from the main videos, we also had quick revision videos in Doc Tutorials. So as you said, oncology is vast, but how did the quick revision videos help you revise it again in a more concise manner?
Sir, I made the notes of all the quick revision videos.
Okay.
I made the notes in the very early itself, in the
Okay.
February itself.
Okay.
And then I used to revise whenever I get time, whenever I get half an hour or 1 hour in the evening times. And then just before exam of 2 days before, I made the revision of 3 times.
3 times.
3 times. So most of the questions has come from those revision part only.
Okay. So I think it's very important to revise properly, because even during that conversation, Mounika, you were saying about revising it 3 times. Now that is important. Even a topper needs a good revision. That is something you should all understand. So you try to make your content concise, crisp, and then go through it again and again. And also coming to the recall videos, Dr. Hemant sir and Vijay sir also had done recall videos of the oncology part. And we all know that for preparing for any competitive entrance exam, knowing what questions were asked in the previous years gives you a fair enough idea, because then you know which all topics to focus more upon. So did you watch all those recall videos, and did it help you in your preparation?
Sir, I watched almost all the videos and I have made the notes for that also.
Okay, for the recall videos as well.
Recall videos also. Before exam also I have gone through those questions. So most of the INS is most about the previous year's questions only. They have most number of repeats.
Okay.
So even this INS also they have some repeats.
Okay.
So that just looking at the question, I know this is the question which has come. I just marked without any.
So you were very happy also seeing probably the exact question as
Yes.
well. Okay. So that's very important, to have a proper understanding of the exam pattern and the previous year questions. Dr. Vineetha, what I would also like to know from you is regarding grand test, the importance of grand test in preparation. So can you just tell us about how grand test helped you monitor your progress?
So reading is one part of it, and reinforcing what we have read is the other part. So grant tests help in reinforcing the memory that we have built by reading. So initially when I started doing grant tests, I have just given one reading. I did not know what topics to focus on.
Okay.
So when I started doing the grant tests, I understood which topics to focus on, which topics are frequently being asked. So that is one advantage of doing a grant test. You will know where to focus on. And other thing is, when you're tracking your progress in your grant tests, then you'll know whether you're improving or what are the
Static.
weak areas and all such things.
Okay, right. And just again to emphasize that point, when you started off your grand test, can you just tell me what is probably the lowest that you got, if you can remember, in a grand test?
So I used to see the scores only initially because I was not preparing completely. Like my preparation was not to the full extent. So initially my scores were very low, like around the INISS pattern, it was around 45 to 50.
Okay.
So as I improved in my preparation and I started revising and I understood which topics to actually focus on, the grand tests towards the final exam, I scored around 55 to 60.
Okay.
And that also reflected in the final exam.
Okay, right. Somnath, medicine, as we know, is a pretty vast subject.
Absolutely. Sir.
Now, when you prepare for a subject like medicine, see, content wise, yes, you will have to watch video lectures and understand, but also important is MCQ practice and also approach to the MCQs as well. Which is why when we designed the course for doc tutorials, we had a separate section, that is the Elite test and discussion videos, wherein we conducted exams, and each topic, say for example, neurology was again subdivided into modules and we conducted exams for it. So these were test and discussion sessions and these were uploaded in the app as well. So I just want to know, like, how did these Elite test and discussions help you in your preparation?
So as we know, sir, in INISS, a significant part is also from general medicine. So preparing for general medicine also is also very important, apart from the super specialty subject. So, and since doc tutorials is, I think, the only platform to offer us this elite test series through which we can go through each and every topic in a time-bound manner, and then after going through the topic, there is this test, and after the test, there is a discussion. So all at once we can read it, we can give the test to see where we are, and by the discussions, I think we can improve on our shortcomings by the discussions, going through the discussions, and then going through it again by making notes and all. I think it's pretty much more convenient to prepare for the medicine part than going through all exhaustive videos.
So it's a very valid point that Dr. Somnath, you have spoken about the Elite test and discussions. So basically the purpose of these discussion sessions is that the student actually gets an opportunity to see how the faculty will approach if they were a student appearing for the exam. So such sort of approach is very important, especially for dealing with clinical scenario based questions. So yeah, I think, I agree with your point on Elite test and discussion sessions. Dr. Mounika, grand test in any platform should simulate the actual exam pattern. So I just want to know, first of all, from you, how were the grand tests in doc tutorials and how did it help you for your preparation? And secondly, your message to the future aspirants who are a bit reluctant probably on taking grand tests, because some students keep reading but may not be willing to do the grand test. So First of all, just take us through the grand test of doc tutorials.
The grand test of doctor is almost the similar to the final paper. So almost same, and then I started my grand test preparation in very early, like in February only. I used to do one grand test every 15 days. So I used to make the score, how much I have made, and I used to put how many rounds I have done, and how many rights and how many guess questions. That's how I used to make a list. Initially, my score is very, or on average is just 50%, 60%. So it gradually improved with the more number of revisions, and with the by the end of the last 3 4 grand tests I got the rank of 2 2 3 4, around less than 5. So this grand test is almost similar to the final paper, and it helped me, like this grand test help in the ruling out of the options. Even if you know the topic and you don't know the answer, you just need to rule out and you can put the answer.
Now, the next question I want to ask all three of you is regarding the importance of mentorship in your exam preparation. Because I know it's a long journey, and even though you're preparing at this particular age of yours, I'm not saying that you all are old, but still, you would still require that sort of hand holding, and mentorship is what I believe. And I would like to know from you, how did the faculties in doc tutorials mentor you in your way forward? I'll start with Dr. Mounika. So Mounika, for oncology, we had Dr. Hemant sir and Vijay sir. So were they approachable, and did you reach out to them when you had a trouble, and how did they actually help you?
So there is a WhatsApp group called Doctoral Mentorship, and in medical oncology is all about chemotherapy drug. Every day, Hemant sir and Vijay sir used to put one drug, discuss about this drug. So he used to put out the points. You have to discuss all these points. Then each resident used to answer those questions. Like we made a list of methotrexate or anything which are most important. Almost in those like 2 months, we complete all the drugs were important. Just before the exam, also we used to go through all those important points. That helped me a lot. And just even if I have any doubt, even if it is very silly question, also I used to message Vijay sir. I used to message Hemant sir. They used to reply. They used to call and reply. They used to explain. Even though I didn't understand that topic well, anything, they used to explain twice or thrice. They helped me a lot in this.
Hats off to Dr. Vijay and Dr. Hemant for helping out. Now, we'll just move to Dr. Vineetha. And Dr. Vineetha, for rheumatology, I know that Dr. Vishnu is very active in his WhatsApp groups as well. So I've seen, Dr. Vishnu giving time and again some reminders. So you have to study this. This is important. I've seen him putting some important tables. So can you just take us through the mentorship, other than, the teachings, the mentorship that Dr. Vishnu provided?
So, Dr. Vishnu always used to not only put the aspects of the questions which are focused on in the exam, but also he used to encourage, like if there is a fixed amount of time period, he used to give a schedule how to try and complete things in that given schedule. Like not a fixed schedule, just an idea. So that idea itself is encouraging that we can do things. And also he used to post questions and some tables from Kelly, and he used to keep asking some questions through voting in WhatsApp group. So all those helped in. We used to start mark those questions, and we used to revise those before the exam. So that is very helpful for quick revision before the exam as well.
And Dr. Somnath, even for medical gastroenterology, we know that, again, Dr. Prashant Gandhi, he used to put many questions in those WhatsApp groups as well, some MCQs, some important points, and trying to make you answer as well. So how useful was it? Because you have got a WhatsApp group with people who are targeting for the same exam. So you get to know, right, like what sort of questions are being asked, and how others are answering as well. So how did Dr. Prashant Gandhi actually mentor you in your journey?
Prashant sir has been nothing short of a blessing in this journey, because the way he used to personally help each and every person regarding the silliest of doubts. And apart from that, the questions he used to put mostly on the latest updates. And as we know, in latest updates are very important topic part of preparation for INI, because latest updates are definitely asked. At least 2 or 3 questions are expected, and which can sometimes be rank deciders as well. latest update questions. So he used to post a lot of questions, mostly from the latest updates, and he used to also post a few voice messages, like WhatsApp messages, but voice messages. Like if you go through the voice messages, you can understand the topic very easily in 2 to 3 minutes, like, and you do not need to go through the book or table or something. You just listen to the voice message over and again, and you get a clear idea of what the topic is.
That sort of mentorship actually helps you a lot, okay, because in a voice message sometimes the faculty may be able to concise a lot of content as well. I also just want to tell the students who are listening to me about the importance of solving question banks. Now, sometimes what happens is when you prepare for competitive entrance exams, you keep reading a lot of stuff, but you do not practice MCQs. So one thing good about doc tutorials is that whether you are preparing for NEET SS or INISS, there are dedicated question banks for each of this. So the good thing is once you listen to a particular lecture, maybe the NEET SS medical group or the INISS, you can then solve the MCQs as well to assess your preparation. So my personal take is that how you should use the Qbank should be in such a way that you first watch the video lecture, and once you're done with a few modules, please come to the question bank and start solving the questions. And if you look at the Qbank of doc tutorials, all of the questions are updated with references from the latest edition of standard textbooks. So I think definitely the Qbank is also something that you should not miss from doc tutorials as well. And something I just want to ask you all as well is regarding the importance of solving such questions. Dr. Somnath, I just want to know from you that how was your strategy? Did you solve questions from the Qbank, and how did actually it help you in assessing where you have done well or maybe your deficient areas as well?
Mainly, the focus of my MCQ solving was on the Slicenger review book, but a few topics are not well covered because since it's an American book, so the topics which are more important from the Indian perspective are less covered in it. So, but in the doc tutorials question bank, I found quite a few questions which were covered from a few Indian guidelines or Asia Pacific guidelines. And going through that, and also there were references present as to which part of the textbook I should refer to. And so reading that topic from there after going through the question bank also helped. Because since the question bank is extensive, I could not go through each and every topic, but the topics which were deficient in the review book, I definitely went through it, and it definitely helped in better understanding of those topics.
Okay. So, Dr. Mounika, your take on the importance of solving such questions as well.
Like questions everyone must do, because it helps in understanding the topic, and it helps it tells us to do how to approach a question and how to rule out the options, and then how much knowledge you have gained through these videos and with your notes.
And also in your case, what do you have to tell to the future aspirants as well, of the importance of solving such questions?
So question bank, one way it can be useful is when we are doing grant tests, we can identify some particular areas which we are weak at, and we can go and do question bank of that particular area, and we can see which part of it is deficient, and we can improve on that. So question banks can kind of focus on a specific topic as well. Like grant tests are on the whole subject, so question banks can be helpful in revising a specific topic and doing a specific topic.
Somnath, something else which I want to ask you is regarding the importance of giving grant test. Because sometimes what can happen is when you immerse yourself in medicine, you tend to learn many things without giving a grant test to assess your preparation. Because in INI also we know that we have got a pattern of the majority questions being of the the corresponding super specialty subject, and then a segment of medicine as well. So first of all, please tell us on how the grant test will actually help a candidate assess himself for the preparation.
I think grant tests are a very vital part of any preparation, because with the grant test, because so many students who are seriously preparing for the exam are also appearing it. And so if we appear in a grant test, we all get to know where exactly we are in the competition. And apart from that, especially about the doc tutorials grant test, I think it's a very realistic mock of what the actual exam is like, because the questions and the topics which are frequently repeated in the INI is also there in the doc tutorials grant test. So means time management, and apart from that, the type of questions and how to manage time and how to approach the questions is more doable if we consistently appear for grant tests.
Okay. So I think that consistency is very important. You have to periodically give grant test so as to assess your preparation. And you can actually, it's almost like taking a track of your own journey.
Yes.
Like, I just want to know, when you started giving grant test in doc tutorials, like, can I know what was your initial ranks in the grant test, and then subsequently, how were you scoring in these grant tests?
So initially, I think my ranks were a bit behind, like in the 30s or maybe even the 50s. But as time went on, and as my preparation went in the more serious mode, and I started getting a gist of it. So my test ranks gradually improved, and in the last grand test, I think I was in the top 5 as well.
Okay. So that again is very important. He actually tracked his progress, because when you prepare for an exam like INI, where the number of seats are very much limited, you have to get into that top 5 ranks consistently. And I think you could track your progress also by giving these grand tests, and probably that gave you the confidence as well. Near the major INI exam, seeing all your ranks being in the top range would have given you a lot of confidence as well. Mounika, you have watched oncology videos of Dr. Hemant. So, what is one message you want to tell Dr. Hemant through this interview?
To Dr. Hemant.
Dr. Hemant. So, he is watching.
Sir, you're a very good teacher. You're the one who inspires me. I used to ask him doubts at all the time, like evening, morning, anytime. He used to reply and he used to explain in a detailed way. And thank you so much, sir, for your help. And with your help, I got.
Dr. Hemant? So, finally, we bring this discussion to a close, and I must thank all three of you for coming here and sharing your views about your preparation journey to all dear students listening. And I'm sure that the valuable insights that you have provided will definitely help all the aspirants preparing for the INISS exams as well. It was very nice talking to all of you, and the viewers also have understood that you're not very serious people, and the toppers are also fun loving as well. I'll definitely look forward to meeting you in the future as well. And on behalf of Doc Tutorials, the faculties, and the entire team, we wish all three of you good luck for the future. Thank you so much for
Thank you, sir.